Hi, this is Angelina Asante. Welcome to another episode of The Healthy Hypochondriac. Today, I'm going to discuss something that is a secret I thought I would take to my grave. I'll be discussing something very few people in my life actually know I have. It's an embarrassing problem, but as a direct result of my cancer surgery, I have no feeling when I have to pee. There is good news for most of you, not me, but there are things you can do to help. If you're a man experiencing problems with UTI, I also have information about UCLA's prostate and urology program. Unfortunately, this problem I have and UTIs are very much in common. There's also exercise programs to help men and women preventing UTIs from coming back. Now, I don't suffer from UTI. I haven't had one, knock on wood, since my surgery 6 years ago. But in researching this topic today, I found out a lot of people have this problem. Right now, I'm talking specifically how this issue affects women post-surgery, because that is my issue. But men, I'm with you. I don't want to hear about my lady problems either. But here's one now. In 2015, when my doctor performed my radical hysterectomy, he relocated my bladder. And as a result, I lost the signal that told me when I have to go. Now I'm like a toddler and have to schedule bathroom breaks. Because the uterus supports the bladder and plays a large part in telling your body when you have to go, many women lose the sensation after hysterectomy. Initially being told the feeling would return at my 2-week, 1-month, 6-month, and year checkups. Now that I'm a 6-year cancer survivor, I'm not optimistic about its return. So what caused this thing I took for granted all these years to leave? There are 4 culprits I'm going to be discussing today. Bladder injury. This is when the surgeon accidentally nicks your bladder during the surgery and happens to 12,000 women every year. Overactive bladder. This is the feeling you have to pee all the time, even though you can't actually do it when you try. This is your body's detrusor muscle malfunctioning. Weak bladder. Forget the trampoline. This is the inability to cough or laugh without a little urine squeaking out. This is also due to muscle weakness around the bladder. Bladder infection. UTI, urinary tract infections, are common after hysterectomy. Here's some symptoms. Pain or burning while urinating, having the feeling you need to pee but you can't, making multiple trips to the bathroom but not getting a steady stream, dark, cloudy, or smelly urine. The reason for the increase of this infection after hysterectomy is because the drop in estrogen weakens the supportive tissue around the urethra. There are some solutions to this problem. If you're diagnosed with a bladder infection, there are antibiotics you can take to cure it within 5 to 7 days. However, with all medicines, you need to finish your prescription to reduce the chances of it recurring. There are some preventative measures you can take to prevent it from happening again. Kegel exercises. They help you strengthen your pelvic floor by making the muscles around your bladder stronger. Minimize your intake of alcohol, coffee, and soda, which aggravates the bladder. If you're overweight, you need to lose weight to minimize pressure on your bladder and all of your joints in general. Acupressure. You'd be surprised how many videos on using acupressure are on YouTube. You need to be open to some Eastern medicine, even if you're prescribed a prescription. Cranberry juice or supplements. I'll be talking more about that later. Estrogen cream, hormone replacement, or yoga. If you think you have a urinary tract infection, you need to contact your doctor or go to a health clinic immediately. According to the CDC's website, 13,000 people die from UTIs every year. Among other problems, your kidneys can shut down completely, so you need to take it seriously. The older you get, the more frequent they can become, and when you factor in dementia or Alzheimer's, where the patient may not realize or remember they have to use the bathroom, UTIs can become deadly. For now, I'm going to add some show notes from the Mayo Clinic about UTIs, hysterectomies, and even a how-to guide for women. I'll also include an article with links for men from the UCLA Health's prostate program. They have exercises that can help you. There are also mixed reviews about how and if cranberry really can help, so I've included a link to the Cleveland Clinic, which has some really helpful information. On next week's episode, I'll be talking about something that has also helped me and several other people with the owner and two-time late-stage cancer survivor Lisa Diamond of Be Vibrant Power Plate and Beamer Studio in Naples, Florida. That episode may change your life if you suffer from debilitating lymphedema like I did. Notice I used a past tense verb there. If you suffer from lymphedema like I do, you absolutely want to listen to next week's show. Thanks for tuning in this week. This has been Angelina Asante. Have a great week.